YomHealth. Professional care right where you are. 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 YomHealth.
All right. Thank you so much for taking the time to join us today. We truly appreciate it at YomHealth. Whether you're a health professional, a student, or a partner, or someone who is just simply curious about what we are building, your presence here means a lot to us and to the YomHealth team. My name is Bernard Yaogomashi. I am the founder of YomHealth. Today isn't about a finished product or big promises. It's about a problem many of us experience, either as patients, caregivers, or health professionals, and a simple idea that we all believe in, right? At its core, YomHealth exists to make it easier for people to access trusted healthcare and for health professionals to reach those who need them. That is it. That single idea has guided every single decision we've made so far. Over the past month, I've had conversations with nurses, midwives, physiotherapists, students, and everyday users. I've listened to their stories about long waiting times, limited access, and health professionals who genuinely want to help more people, but don't always have the right tools to do so. Those conversations are the reasons YomHealth exists. Today, I want to briefly share why we decided to build YomHealth, what the platform does, and how you can be part of this journey moving forward. This is just a beginning. I am really glad you are here with us at the very start. Once again, thank you for joining us. To continue further, I am going to welcome Madam Edith Odro, who is going to facilitate the entire event. Let us welcome Madam Edith.
Thank you very much, Mr. Bernard. We must say we are very honored to have someone like you who has the people of Ghana at heart. You know, YomHealth is a solution to the many problems or the many healthcare problems patients and health professionals face. And to every solution, there's a problem that inspires it. My name is Edith Odro, and today I'll be guiding you through the program outline. To kickstart the event, we'll be looking at 3 main problems that inspired YomHealth to be built. Our first speaker is from the patient representative team. He'll be sharing with us real-life experience on how access to timely care affects our health. Please welcome with us Mr. Eugene Osei.
For me as a patient, My main concern about healthcare delivery is access to timely care. Accessing healthcare shouldn't feel like a struggle, but for many people, it still does. We have spoken to many users who needed healthcare but couldn't get it on time, whether because of distance, long waiting.
As a patient, you one way or the other need some medical attention, and then due to maybe long waiting queue, you may not be able to access your medical attention that you so much need. And that is where YomHealth comes to the rescue. I would want us to just watch this clip for better understanding. Thank you.
For me as a patient, my main concern about healthcare delivery is access to timely care. Accessing healthcare shouldn't feel like a struggle, but for many people, it still does. We have spoken to many users who needed healthcare but couldn't get it on time, whether because of distance. For me as a patient, my main concern about healthcare delivery is access to timely care. Accessing healthcare shouldn't feel like a struggle, but for many people, it still does. We have spoken to many users who needed healthcare but couldn't get it on time, whether because of distance, long waiting queue, or perhaps uncertainty about where to go to. Sometimes it's not even an emergency, but knowing who to contact is a challenge. These delays do not just affect health outcomes, but also the peace of mind. People want reassurance, timely interventions, especially when it matters the most. This challenge is one of the reasons platforms like YomHealth are needed.
Thank you very much, Mr. Eugene, for helping us understand how this problem, that is the access to healthcare, does not only delay treatment, but also affects our peace of mind. We have an honor of having a speech from one of our very own. She's a health professional with many years of experience. She's a nurse, and she'll be telling us how pressure on health professionals impacts health. Please welcome with us Miss Lucy.
Hello everyone, I am Lucy. As health professionals, many of us genuinely want to help more people, but we are often stretched, long hours, limited resources, and systems that don't always acknowledge the value of the support we can.
care beyond the traditional settings, but we lack the tools to connect safely and efficiently with patients. The desire to help is there. What is missing is a better way to bridge that gap without increasing any burnout. Thank you so much.
Thank you very much, Miss Lucy. We deeply appreciate how you took us through the various pressures that you health workers face and how it impacts your willingness to serve us who are patients or people in the country. To run up this section, we have another speaker from the YomHealth System and Operation Team. She will highlight the gap between patients and providers. Please welcome with us Miss Edith.
Well, thank you, Edith, and thank you, Lucy, for helping us really understand the roadmap. And we are fleshing out what is really at stake, what is the gap, and I'll take this from a system perspective. Okay, so when you are looking at it from a system perspective, you are really realizing that we have a very significant problem. Now, in times of crisis, one thing that we do really observe is that patients do not know the right professional to contact. They find it hard to find the right person to contact, and it's not their fault. The fact is that qualified medical professionals are very hard to find, and the visibility is very low. It's very difficult to really observe and see the the right professionals because we are not able to see them on the various platforms that we need to locate them at. Not only this, when we are looking at it from our society, we do observe that specialists and doctors as a whole are largely concentrated within cities and in visible places, leaving large communities without people that are well qualified to be able to meet them. We call them certified medical professionals in that regards. Now, to realize that, to be honest, we have people that are very well qualified, and in honesty, they want to really help. There's a willingness and a passion to really serve. But there seems to be a problem here. Based on the current system that we have, most of them are underutilized, and there's a large level of unemployment. It's preventing them from being utilized to really provide the needs for the medical needs that is needed for the people. Now, this creates a very, very big gap, and we see them every day in our daily lives. We see them everywhere we go. We realize that they are delayed treatments. They are missing opportunities that occur. We have our current facilities being overwhelmed and overloaded by the kind of pressure that exists. And we observe that there's frustration everywhere between various people. Now, this is a big crisis, and that's what YomHealth aims to solve. What YomHealth aims to solve is to solve the disconnect between patients and providers. And that's why we are encouraging everyone to support us on this roadmap, because we need to be able to fix it. Honestly, we do realize that it's not because people do not care about the solution. It is because the current system that is designed makes it very difficult for people to be able to locate one another, both the patients and the providers. And that's why we are really encouraging everyone here to really support us on this project and ensuring that we're able to provide the solution that is needed. So that is it for the gaps that is needed, and locating it back to Edith to take us to the roadmap of how YomHealth is really helping to solve this problem. Thank you.
Appreciate the way you explained for us to understand how this affects the treatment that we get and also health workers
From the system
in terms of employment. Now, it's because of these challenges that YomHealth was built. Let us now look at what we are doing to address such problems. Our next section will be looking at the various solutions that YomHealth brings to our doorstep. Our first speaker in this section is a core member of the YomHealth. She's someone who's very dedicated to the cause of or the purpose of YomHealth. She'll be helping us understand what YomHealth stands for. Please welcome with us Miss Kunim.
Hello, I'm Debbie. YomHealth is a digital platform designed to help people connect with trusted healthcare professions more easily. YomHealth is bringing a paradigm shift in the healthcare system. It defines how healthcare is accessed and delivered. With YomHealth, healthcare can be delivered to you at your convenience. The nurses, doctors, and physiotherapists literally moves to your location to take care of you. We are not talking about virtual consultation where you are left on your at a trusted care that will take care of you at your time of need. YomHealth is about connection, bringing people who need care closer to professionals who are ready to help. At its heart, thank you.
Thank you very much. Now, I know that the question on many people's mind is YomHealth for everyone? Well, we have it as a member from the outreach community from YomHealth. He will be taking us through who YomHealth is for. Is it accessible to anyone? Can you and I also participate? Please welcome with us Mr. Daniel as he takes us through who YomHealth is for.
YomHealth is for everyone. Health is so essential that we cannot leave some people out. The YomHealth system seeks to bring two relevant groups of people together to make an impact. The first groups are individuals and families who are seeking simpler, faster access to healthcare, guidance, and support. So these are people who want to avoid unnecessary delays, frustrations at facilities, long hospital verifications and documents. Whether you have the financial capability, you have the access, and no matter the phone you are using, you can log on to the YomHealth platform and access healthcare easily. Also, the YomHealth system is designed for certified and registered health workers who are recognized by the Ghana Health Service. This includes nurses, midwives, physician assistants, physiotherapists, doctors, and all other health professionals. The system seeks to connect patients to the relevant health workers to access their healthcare in time. With YomHealth, there is no limit to possibilities. These are for health professionals who want to learn, grow, and make extra income and be part of the modern healthcare system.
Thank you very, very much. Now, our next speaker is going to be talking about the problem that YomHealth seeks to solve. We have a founding member, we have it as a founding member of the YomHealth Committee. My apologies. And our next member is an intern at YomHealth. He's someone whose dedication speaks through his work. And today he'll be taking us through what YomHealth is for.
YomHealth is for everyone. Health is so essential that we cannot leave some people out. The YomHealth system seeks to bring two relevant groups of people together to make an impact. The first groups are individuals and families who are seeking simpler, faster access to healthcare, guidance, and support. So these are people who want to avoid unnecessary delays, frustrations at facilities, long hospital verifications and documents. Whether you have the financial capability, you have the access, and no matter the phone you are using, you can log on to the YomHealth platform and access healthcare easily. The YomHealth system is designed for certified and registered health workers who are recognized by the Ghana Health Service. This includes nurses, midwives, physician assistants, physiotherapists, doctors, and all other health professionals. The system seeks to connect patients to the relevant health workers to access their healthcare in time. With YomHealth, there is no limit to possibilities. These are for health professionals who want to learn, grow, and make extra income and be part of the modern healthcare system.
Thank you very, very much, Mr. Daniel, for helping us understand who YomHealth is for. Our next speaker is from the founding team of YomHealth. He's someone whose many talents speaks through his work, someone who is so dedicated to the purpose of YomHealth. He'll be taking us through the problems that YomHealth helps solve. Please welcome with us, Mr. Fred.
YomHealth helps close the gaps between patients and providers. It reduces the uncertainty people feel when they don't know where to turn for care, and it gives health professionals a clearer, more organized ways to offer their services. YomHealth helps close the gaps between patients and providers. It reduces the uncertainty people feel when they don't know where to turn for care, and it gives health professionals a clearer, more organized ways to offer their services. By improving communication and access, help both sides, reduces stress, and focus on what really matters: care and income.
Thank you very much, Mr. Fred. Now that we know who YomHealth is for, what YomHealth stands for, and the problem it solves, we will now see a live demonstration on how YomHealth works. We have with us Mr. Wisdom and Chima, who'll be showing us a live demonstration of how it works.
Open YomHealth. Make sure your availability is on, so you go to receive requests. You see incoming requests from patients in the incoming request tab below the screen, phone screen. Now you wait for a request. Make sure your availability is on, so you go to receive requests. You see incoming requests from patients in the incoming request tab below the screen, phone screen. Now you wait for a request. So once you open the app, you see a healthcare professional. Then you request the healthcare professional. You can choose to add a message, which is optional. There you see a distance, then the ETA. So yeah, I'm requesting. So now we wait for the healthcare professional. Incoming request received from patient vehicle. Accept request. Route is on his way to our location. You can show a map and you can view the patient info and location. Show map allows you to see the person's location on Google Maps, where you can then track the person to his or her location. Here, patient vehicle is 42 minutes away. So Dave, our medical professional, has arrived and the healthcare session has started. You can see the session in progress being recorded, the time being recorded. You can see the time on the site is being recorded. You can also record vitals of the patient as you care for them. Then you can also record treatment and submit them to be used for further treatment or on the next session. Record vitals, then record treatment.